Hi, my name is Chantel Garcia. I will be presenting case study 2. My course number is SPCE 638, section 809. This is for Dr. Wendy Weller. The date is October 20th, 2024. Okay, so let's get into it. I'm going to be reiterating the behavior targets that I talked about in case study 1, which is the self-injurious behaviors, property destruction, elopement, the multiply maintained. That I have in that chart is the self-touching, which is multiply maintained by the automatic and escape functions, as well as aggression, which is multiply maintained by tangible and escape. ACAP does not exhibit any attention maintained behaviors. Self-injurious behaviors are defined as any instance of hitting self, throwing self into others or objects, and using any part of therapist's body to her head. Examples include intertwining fingers and forcefully tapping on forehead, or having open palms to forehead with force. Non-examples include patting lap, scratching forehead, etc. Property destruction is defined as any instance of throwing an object or hitting an object with moderate force, and it also includes any action that may result in broken or lost stimuli if the RBT is not present. Examples include throwing her iPad, crumpling paper, slamming down bottle. Non-examples is tapping drum, kicking a ball while playing, throwing a ball. Elopement, the operational definition of that is moving a distance of more than 5 feet from the assigned therapist without permission. If the patient passes through the plano door or turns a doorknob without permission, that counts as elopement. What also includes an elopement is getting out of seat without mandating to stand up. Examples include running away from her seat, wandering to a different room while walking with therapists or just walking to another room without the therapist. Non-examples is walking to the door after mandating for door, or walking with the therapist to a room. Next, I will be talking about self-touching. The operational definition for self-touching is the patient engaging in repetitive back and forth motions within the pelvic region, either on objects or on others. This is multiply maintained by escape and the automatic function. Examples include engaging in back and forth motions in pelvic region outside of the bathroom. Non-examples include engaging in back and forth motions while in the restroom. I write that it's in the restroom because she can engage in self-touching in an appropriate place. There's a time and place for that. Another good example would be engaging in back and forth motions in her pelvic region, like on the window or on a table or a chair. That would be an example of self-touching. Yeah. Next, I will be talking about aggression. This is maintained by tangible and escape. Aggression is operationally defined as any occurrence of forceful hitting, grabbing, kicking, scratching, biting, pushing, spitting towards or directed at others. She could use any part of her body to forcefully engage with aggression with the intent to hurt that person. Examples include slamming hands on therapist's chest, extending foot to therapist's pelvic region or legs, grabbing therapist's fingers and pushing down fingers on nails. So grabbing, and then her nails are here. Non-examples include engaging with high fives, hand clapping games, passing a ball to appear with the intent to play. So the behavior target that I would like to talk about are her elopements. They've been increasing lately because we changed location of where we are in the clinic. I reiterated her topographies of elopements, as well as reiterating the operational definition. We chose to record her elopements using frequency data recording method because it occurs often, it's clear and quantifiable, and can track across different time periods and can be used in different settings. The interventions that we chose, which I will be talking about later, as well as the consequences and the antecedent strategies. They will be implemented by other RBTs, and my mentor and I, my BCBA supervisor, and I will be doing inter-observer agreements and evaluations of our team to see if the intervention is working. If the inter-observer agreement ends up with less than 90%, then we will go back in the data and look at where the disconnect is and see if we need any behavior modifications. According to the task list, I will be stating intervention goals in observable and measurable terms. I will determine how to apply culturally sensitive interventions to my future practice as a behavior analyst and monitor client progress and treatment integrity by using IOA and doing evaluations and seeing if we need further training or behavior modifications. So I would like to do antecedent strategies for elopement first. So during discrete trial training, we're going to have ACAP sit on the chair closest to the wall. It's just to prevent her from, like increasing the distance from the door and herself. During reinforcement breaks, the therapist should stand within arm's reach of ACAP when she is wandering in the room so that she can response block ACAP from leaving without permission. The therapist should always be near doorway ready to block just in case ACAP attempts to elope. Every attempt to elope counts as a frequency count. So how we're treating elopements is because it's for escape. We're going to do a safety walk, which is practicing with an adult how to appropriately transition and walk to different parts of the clinic. And this will be done during discrete trial training. ACAP will be practicing walking with adults, turning 180 degrees and 90 degrees with error correction. The SD will be walk with me. The prompts used will be independent, verbal, and full physical. We can use a shoulder guide if we have to. This is shoulder guiding her. That'd be a physical prompt. We're going to repeat it until she completes the step without elopement. We're going to be using differential reinforcement. If she completes the step independently, we're going to provide praise contingent on following directions. And if ACAP completes the entire time segment without engaging in elopements, she can get access to a highly preferred reinforcer. If she gets up from the table while using her tablet, we're going to count it as an elopement. We're going to have her, we can return her tablet, but she needs to man for it. We're going to return ACAP to the original location using 3-step prompting. The verbal prompt would be come here. This falls under the BACB task list, determine when consent and assent should be gained with client, because we're going to be assessing how what her motivation is. Like, is she eloping to escape, or does she need a tangible? Yeah. So research investigated the efficiency of using graduated guidance along with differential reinforcement and walking with an adult without reinforcement, with participants. It's a participant with autism, about 4 years old, all about 4 years old. They use differential reinforcement graduated guidance, and they just practice how to walk with an adult without elopement. And they found that using that intervention, the prompts were eventually faded and they reinforced appropriate walking behavior until mastery. This falls under identifying potential interventions based on assessment results and the best available scientific evidence available. Next, I would like to talk about functional communication training in treating escape maintain elopements. Using functional communication training, we're going to see what her motivation is for. Is it for standing up? Is it to go to a specific location, like the lobby or the library or the motor room? We're also going to combine it with differential reinforcement. It's going to be 10 seconds for prompted mans and 30 seconds for independent mans. If the man is prompted, we're going to return ACAP to the original location, and then we're going to give her the opportunity to man for the specified location or action independently. If she doesn't show interest, we're not going to prompt her to band. This falls under planning for possible and wanted effects using reinforcement, extinction, and punishment procedures, H5, and recommending intervention goals and strategies based on such factors as client preferences, supporting environments, risks, constraints, and social validity. Social validity is a big thing because we would like for her to use her words so that when she is with mom, she can advocate to her for herself. She can advocate for herself when she is with mom, and it's socially appropriate. The evidence that backs up the treating escape maintain elopements with FCT is this research article right here. Pennington and Associates, they did a study on analyzing the use of FCT to reduce elopement. They taught participants to man for walk, and combined with differential reinforcement, the intervention led to an increase in communication, and it reduced elopement attempts, and they were able to generalize over time and settings. And that concludes my PowerPoint. Thank you so much for your time. I did my best. I was a little nervous, but thank you for this opportunity and hearing my presentation. Bye.